Attention seniors, before you swallow your next pill, you need to hear this. Because even if your doctor prescribed it, even if you've been taking it for years, one small mistake could be hurting your health right now. Today, I'm exposing 7 common prescription mistakes that quietly harm older adults every single day. And here's the shocking part. Most of these slip-ups happen at home, not at the pharmacy. Stick with me until the end, because mistake number 7, it's one that even experienced caregivers overlook, and it can be life-threatening. And before we dive in, do me a favor. If you've ever worried about your prescriptions, tap that like button so this video reaches more seniors who need the warning. And drop a quick comment below. Have you ever had a bad reaction to a medication? I'd love to know. All right, let's get into it. Mistake number 1. Mixing medications without realizing it. This is one of the most dangerous mistakes because it happens silently. Picture this. Your heart doctor prescribes a blood thinner. Your dentist gives you an antibiotic. And you're also taking something for sleep. Separately, they may be safe. Together, they could trigger internal bleeding, dizziness, or a fall. The truth is, once you're over 60, the average person is on at least 4 to 6 daily prescriptions. Add in vitamins, pain relievers, or over-the-counter meds, and suddenly you're juggling a chemical cocktail. And no, doctors don't always catch these conflicts, especially if different specialists are prescribing to you. The fix is simple but powerful. Keep an up-to-date medication list, carry it to every appointment, show it to your pharmacist. And if you start anything new, even an over-the-counter allergy pill, double-check interactions first. Because mixing meds is like mixing chemicals in a lab. Some reactions are explosive. Mistake number 2, skipping doses or doubling up. We've all done it. You forget your morning pill, so at dinner you take 2. Or you may feel fine, so you skip a dose. The problem is, medications don't work like light switches. They build up in your system to maintain steady levels. Missing one dose might seem harmless, but with blood pressure pills, it can trigger sudden spikes. Doubling up can swing you the other way. Dangerously low blood pressure, dizziness, even fainting. I had a patient who made up for a missed diabetes pill by doubling up the next morning. By lunchtime, he was shaky, sweating, and nearly collapsed from low blood sugar. So here's the rule. If you miss a dose, don't panic. Call your pharmacist or follow the instructions on the bottle. Most of the time, you simply skip and take your next dose as scheduled. Never play catch-up with prescriptions. The risks are higher than you think. Mistake number 3, stopping a prescription too soon. This one happens with antibiotics all the time. You start feeling better after 3 days, so you stop. Or your cholesterol medicine seems to be working, so you figure you don't need it anymore. But stopping too soon can backfire. Antibiotics, the infection comes roaring back, stronger and harder to treat. Blood pressure or cholesterol meds, your numbers creep up quietly until a stroke or heart attack happens. Mistake number 4, using the wrong pill at the wrong time. This one sounds small, but timing matters. Take thyroid medication with breakfast. Coffee blocks absorption. Take blood pressure pills at night. For some, that can cause dizziness when you stand up to use the bathroom. Take sleep meds with alcohol. That's a dangerous mix. It slows breathing and increases fall risk. Even calcium supplements can block other prescriptions if taken too close together. So don't just look at the what, pay attention to the when and the with what. Your pharmacist can print a simple schedule that shows which pills to take morning, noon, or night, and which ones need an empty stomach. That one sheet of paper can save you years of health trouble. Mistake number 5, forgetting about side effects. Every prescription has side effects. But here's the mistake. Seniors often chalk them up to just getting older. Feeling groggy? Blame age. Dry mouth? Must be normal. Unsteady on your feet? Oh, that's just aging. But in reality, it could be your medication talking. Statins can cause muscle pain. Diuretics can dehydrate you. Antidepressants can trigger confusion or falls. I'll never forget a woman in her late 70s who thought her memory loss was early dementia. Turns out it was a side effect of her sleep medication. Once her doctor adjusted it, her clarity returned. So don't ignore new symptoms. If something changes after starting or adjusting a pill, speak up. Don't suffer in silence. Mistake number 6, mixing prescriptions with alcohol or supplements. This one sneaks up on people. A glass of wine with dinner may feel harmless, but mix it with blood pressure meds and your pressure can crash. Supplements are another trap. St. John's wort can interfere with antidepressants. Ginkgo can thin your blood even more if you're already on a blood thinner. The dangerous part is that most supplements are sold as natural, but natural doesn't mean safe when combined with prescriptions. So the golden rule, always ask your pharmacist before adding anything new, even if it's just a vitamin or a herbal tea. Mistake number 7, not reviewing prescriptions regularly. This is the silent killer. Many seniors stay on the same pill for decades, even when their bodies change. But prescriptions should never be set and forget. Maybe your kidney function has changed. Maybe your heart medication dosage is now too strong. Or maybe you're taking 2 pills that do the same job. I've seen patients on 12 medications when 4 could be trimmed safely with proper review. That's why doctors recommend something called a medication reconciliation once a year. You bring in every pill, prescriptions, over-the-counter, vitamins. The doctor or pharmacist reviews them, checks for duplicates, interactions, and unnecessary drugs. One of my patients cut her pill count in half just by doing this and felt more energy, less confusion, and more independence. So ask your doctor, can we review all my prescriptions together? It could add years to your life. So there you have it. 7 prescription mistakes that hurt seniors most. Mistake 1, mixing meds without knowing. Mistake 2, skipping or doubling doses. Mistake 3, stopping prescriptions too soon. Mistake 4, wrong timing. Mistake 5, ignoring side effects. Mistake 6, mixing with alcohol or supplements. Mistake 7, not reviewing prescriptions regularly. Every one of these mistakes is avoidable, and every one can be fixed with a little awareness and communication. Here's the bottom line. Prescriptions can save lives, but only if used correctly. So please, check your meds, ask questions, and never assume it's just age when something feels off. If you learned something new today, hit that like button so other seniors see this warning. Share this video with a friend who takes daily prescriptions. It might save them from a dangerous mistake. And don't forget to subscribe for more senior health tips every single week.